in veins. That is venous system. Well, first of all, general information, and then system of superior vena cava. That is superior vena cava, then brachiocephalic veins, and veins of the head and neck. Till page 218. That is superior vena cava, vena cava superior. It forms with the help of brachiocephalic veins. Right and left brachiocephalic veins join together at the level of cartilage of the first rib on the right side from sternum. They join together from superior vena cava, and only one vein inflow into superior vena cava. That is azygos vein, unpaired vein, vena azygos. And after that, superior vena cava opens into right atrium. We will speak a lot about azygos vein next time. Today, just name and information that this vein opens into superior vena cava. Now, brachiocephalic vein. Brachiocephalic vein forms with the help of internal jugular vein and subclavian vein. Brachiocephalic vein receive blood from vena vertebralis, then that is thyroid gland, vena thyroidea inferior, and vena thoracica interna, and vena thoracica interna, internal thoracic vein. And I think you know that internal thoracic vein forms with the help of vena musculophrenica and vena epigastrica. What? Superior, yes. That is, and vena intercostalis anterioris opens into the internal thoracic vein. That is the same like in arteries. If you remember, the same arteries start from subclavian artery, but veins, vertebral vein, internal thoracic, and inferior thyroid vein opens into brachiocephalic vein. Then, internal jugular vein, vena jugularis interna. Internal jugular vein, it starts from what? What is this opening? Foramen? What is? One again? Foramen? Jugular, yes, from jugular foramen. At the base of the skull, from jugular foramen start internal jugular vein. That is, it is beginning of internal jugular vein. And in place where internal jugular vein start, from jugular foramen, it has dilation, that is bulb, bulbus superior of internal jugular vein, superior bulb, and in place where internal jugular vein joined with subclavian vein, we have inferior bulb, bulbus inferior of internal jugular vein, two bulbs, superior and inferior. Internal jugular vein has two types of inflows, intracranial inflows and extracranial inflows. Intracranial inflows of internal jugular vein, that is, first of all, that is sinuses of dura mater. What is it? Okay, for example, that is frontal bone. That is frontal bone. Well, here it is, we can see only part of frontal bone. Who remember, what is this place? What is this crest? Crista frontalis. And then backward, it continues into sulcus. Who remember what is the name of this sulcus? Sulcus, sinus. This sulcus continues to parietal bone and finish here it is in occipital bone. What is this sulcus? Sulcus, sinus, sagittalis, superior. A groove of superior sagittal sinus. Inside of skull, here it is dura mater. Do you know what is a dura mater? That is hard meninx of brain. Brain has pia mater, soft meninx, arachnoide, and dura mater. And dura mater that is dura mater, it fused with bones of the skull. Here it is with frontal bone, it fused. There is no space between dura mater and bones of the skull. Here and here, there is no space. They fuse together with the help of connective tissue. And here it is the same, two layers of dura mater fused together. Except one place, here it is, this place between bone, frontal bone, and dura mater, we receive space. And in this space, venous blood pass. That is sinus of dura mater. That is not vein, it is not vein, but that is space where venous blood pass. Here it is superior sagittal sinus, sinus sagittalis superior, and this structure, which is separate right and left hemisphere of brain, that is phalanx cerebri. Phalanx cerebri, it consists of two layers of dura mater, and inferior edge of phalanx cerebri, here it is these two layers not fused together, and here it is between these two layers of dura mater we can see inferior sagittal sinus, sinus sagittalis inferior. Sinus sagittalis inferior. Give me your manual one again. Maybe here it is. We can see. Okay. That is phalanx cerebri between right and left hemisphere, and between this phalanx and the bones of the roof of the skull, here it is superior sagittal sinus. In inferior edge of phalanx cerebri, inferior sagittal sinus, and here it is in occipital region. That is phalanx cerebri, and here it is tentorium cerebelli. It separates brain from cerebellum. Here it is hemisphere, right and left hemisphere, and below of this tentorium, here it is cerebellum. And between cerebellum and brain, we have tentorium cerebelli. And in place where phalanx cerebri, that is phalanx cerebri, joined with tentorium cerebelli, between them we have straight sinus, sinus rectus, and this straight sinus opens into confluence sinum. Here it is place where four sinuses join together. Confluence sinum. Here it is superior sagittal sinus finished. Here it is straight sinus finished. Here it is occipital sinus finished. And from this confluence, transverse sinus goes laterally here and here. That is groove of transverse sinus, and here it is tentorium cerebelli attached to this groove, and we receive sinus transversus. Sorry. Remember what is this groove? Groove of which sinus? Sigmoid sinus. Sulcus sinus sigmoide. Here it is. We have sigmoid sinus. Maybe somebody remember what is this groove? Here and here. Yes, superior petrosal sinus, and here it is inferior petrosal sinus. Between these two grooves and dura mater, we have superior and inferior petrosal sinus. along of lesser veins of sphenoid bone, we have sinus sphenoparietalis, here and here. Laterally from sella turcica, we have cavernous sinus, sinus cavernosus. In front and behind of cavernous sinus, here and here, we have sinus intercavernosus. Oh, that is all. That is all. And from all of these sinuses, blood goes to jugular foramen and then continues into internal jugular vein from all sinuses. For example, from superior sagittal sinus, blood goes to confluence sinum. From confluence, continues into transverse sinus. From transverse sinus into sigmoid sinus, and sigmoid sinus goes to jugular foramen. Or another way, sinus sphenoparietalis continues into sinus cavernosus. Sinus cavernosus continues into sinus petrosus inferior and directly to jugular foramen. Or from sinus cavernosus, blood can go to sinus petrosus superior, then sigmoid sinus, and also into jugular foramen. Impossible to see sinus in this base of the skull, impossible to see sinus sagittalis inferior and sinus rectus, because these two sinuses have not got groove on the skull, just between dura mater. Sinus sagittalis inferior continues into straight sinus, sinus rectus. Sinus rectus goes to confluence. From confluence, sinus transversus, sigmoid sinus, and jugular foramen. That is why intracranial inflows of internal jugular vein, they are sinuses of dura mater, that is a first. Then some veins of the skull, for example, ophthalmic vein, vena ophthalmica, it goes into cavernous sinus. Or vena cerebri magna, that is the largest vein of the brain. It opens into place where inferior sagittal sinus, sinus sagittalis inferior, continues into straight sinus, into sinus rectus. And in this place where inferior sagittal continues into straight sinus, in this place, vena cerebri magna inflow from brain, vena cerebri magna. From inner ear, we have vena auditiva. Vena auditiva, it goes to superior and inferior petrosal sinuses. That is, some veins opens into sinuses and then goes to the internal jugular vein. And veins of bones of the skull, for example, vena diploica, they also opens into the sinuses and continues into internal jugular vein. That is intracranial inflows. And extracranial inflows of internal jugular vein, they are facial vein, vena facialis, lingual vein, vena lingualis. Sometimes lingual vein opens into facial vein. Then vena temporalis superficialis and vena maxillaris join together and forms vena retramandibularis. And vena retramandibularis, the same, opens into internal jugular vein. Sometimes facial vein joined with retromandibular vein and opens into internal jugular vein. And superior thyroid vein, vena thyroidea superior and vena thyroidea media. They also opens into internal jugular vein. They are extracranial inflows of internal jugular vein. Next, except internal jugular vein, we have external jugular vein and anterior jugular vein. They are smaller, largest vein, that is internal jugular. But we can see external and anterior jugular veins. Usually these two veins join together and opens into subclavian vein or into venous angle, where internal jugular vein joined with subclavian vein and forms brachiocephalic vein. That is possible that external and anterior jugular veins join together and opens into subclavian or into venous angle. External jugular vein receive blood from occipital vein and posterior auricular vein. Vena auricularis, posterior vena occipitalis join together forms vena jugularis externa, and vena jugularis externa receive blood from vena suprascapularis. And anterior jugular veins here, anterior jugular, right and left anterior jugular veins join together above of jugular notch of sternum and forms venous arch, arcus venosus juguli. Jugular venous arch, arcus venosus juguli, above of jugular notch of sternum. And here it is, this arch and these veins take place in space between lamina superficialis fascia coli propria and lamina profunda fascia coli propria. And name of this space is spatium interaponeuroticum suprasternale. That is a place where jugular arch take place. Arcus venosus juguli in spatium interaponeuroticum suprasternale. Well, I think that is all. One of the most important things, you need to prepare names of all of these sinuses, and you will answer in base of the skull. Names of sinuses. All another information you need to answer. Well, today that is all.